Have you ever felt a burning or stinging pain while peeing? That uncomfortable sensation is called dysuria, and as women, many of us experience this at some point in our lives. But painful urination is not always a simple infection, and ignoring it can sometimes lead to bigger problems. So, let's talk about why this happens and what you should do if you feel this discomfort. When we urinate, the urine passes through a small tube called the urethra. If this urethra or bladder becomes irritated, inflamed, or infected, we experience pain or burning while passing urine. The most common reason for this is a urinary tract infection, or UTI. Along with burning, you might feel the need to pee more often, very urgently, and sometimes only a few drops come out. The urine may look cloudy or have a strong smell. Many women also feel pain or pressure in the lower belly. Now, here's something important. If you also have fever, back pain on one or both sides, chills, nausea, or vomiting, that could be a kidney infection. In that case, don't wait. See a doctor immediately. But painful urination doesn't always mean a UTI. Sometimes the cause can be related to the vagina or genital area. For example, if there is itching, unusual discharge, or redness, it could be vaginal infections like yeast infection or bacterial vaginosis. These are common and can be easily treated. If you have vaginal discharge that's yellow or greenish, bleeding after sex, or pain during sex, it could be cervicitis, inflammation of the cervix, often due to a sexually transmitted infection like chlamydia or gonorrhea. These infections need proper medical treatment because, if ignored, they can travel upward and cause something called pelvic inflammatory disease, which may lead to infertility in the future. Sometimes the pain is actually felt near the opening where urine comes out. That could be urethritis, another possible sign of a sexually transmitted infection. So, any unusual discharge, please get it checked. Another situation, if the pain comes with sudden lower belly discomfort, pain during intercourse, and this keeps happening for weeks or months with normal tests, your doctor may look for interstitial cystitis, also known as bladder pain syndrome. This isn't an infection, but it can still make peeing very painful. Now, let's talk about some less common but important causes. If you notice blood in urine, especially if you smoke or are above 40, your doctor may want to rule out bladder cancer. Don't panic. Most causes of dysuria are not cancer, but this symptom should never be ignored. If you have severe side or back pain, blood in urine, and nausea, it could be kidney stones, tiny crystals that block the urinary tract and cause sharp pain. And for women in or after menopause, lower estrogen levels can make the vaginal tissues dry and irritated, a condition called atrophic vaginitis. This also causes burning while peeing, but the treatment is different. So how do doctors figure out what's going on? Your doctor will start by asking questions about your symptoms. Are you peeing more often? Any itching? Fever? Any changes in discharge? Any recent new partner or unprotected sex? A urine test is usually done to see if an infection is present. If needed, they may do a vaginal exam or swab tests to identify sexually transmitted infections. If infections are ruled out but symptoms continue, doctors may order more tests, like a bladderscope or ultrasound, to find the exact cause. Now, let's focus on when you should not wait. High fever or chills, vomiting or feeling very unwell, severe back or side pain, blood in urine, pregnancy with symptoms of infection, symptoms lasting more than 2 to 3 days without improvement. These are signals that you need medical attention right away. And no matter what, please never start leftover antibiotics on your own. Wrong antibiotics can make things worse and hide the real cause. So if you feel burning while peeing, pay attention to your body. The cause could be simple and easily treated, or it could be a sign that needs timely care. Getting checked early keeps you healthy and protects your long-term urinary and reproductive health.